Okay, good morning. Good morning, everybody. Welcome to this 17th and last webinar of our series. Today we will have three speakers and we will introduce them in a moment. Let me first give you the usual technical information. We have prepared links for the students. You will find the links in the chat. So the first link is for students that need some certification of their participation at this webinar. So this is the link for certification. Then there is the link for the test we have prepared for the high school student. And there are three simple questions that you have to answer related to what the speaker will say. And finally, I put the link of our archive where you can find all the registration of our previous webinars, and you can also find most of the slides we use them. So you see the title of our series is Light on Optical and Optometry, and this is the program we did. So we try to discuss different aspects of optometry and optics, and today we are discussing one argument which is quite important, which is what is optometry around the world. So it's a kind of cherry on the pie of our series. So we will learn from Joanne in US and Shehzad in UK what is optometry in these different countries. And you will learn that in Italy we are very at the infancy of optometry, and we hope that this very simple, let's say, webinar will help to have information to get the picture of optometry around the world. But I will leave the third speaker, which is Fabrizio Zeri, researcher of University of Milan, to introduce the topic and the other speakers. So Fabrizio, please, now you can go ahead from this moment to introduce you and the other speakers. Thank you.
So thank you very much, Massimo, for your kind invitation for this seminar. It's really a pleasure to be here today and introduce my colleagues, Shehzad and Joanne from UK and US respectively. So for us it was really a strange thing to meet together and here in this seminar, because there is a thin fil rouge that links all the speakers today. And I think this thin fil rouge is Italy, because either in terms of personal perspective and also educational perspective, they are linked to Italy. So for example, the brother-in-law of Shehzad is Italian, exactly, is from Tuscany. And clearly, if you see the name of Joanne, the surname of Joanne, you can recognize a very typical Italian surname. So personally, they are linked to our country, but they are also linked to optometry in Italy, because they both, and they maybe can tell later something about that, they were involved in some educational program in Italy in optometry. So Joanne, lots of years ago, maybe Joanne can tell us something, and Shehzad more recently in another experience of optometric education. So just if you want to tell something before I start with the presentation, Joanna and Shehzad.
Sure. So in the early 90s, our college at the New England College of Optometry in Boston set up a program with the college in Verona, Italy. And we actually did an advanced study international program where we sent our faculty to Verona to teach, and then the students came to Boston to do their clinical rotation. So there actually are 8 students, 8 optometrists that graduated from our college in 1997 who are practicing in Italy, who have the American optometry degree.
Okay.
And similarly, Fabrizio, I set up a program with my university in the UK, Aston University, and the IBZ school in Bologna, which was, we call it a 2+2 program. So the students did the 2-year diploma for opticians, and then they did 2 years afterwards with us in Aston University to become optometrists. And some of these people have now applied to the General Optical Council to be registered as optometrist in the UK, and that process is almost complete for at least 4 or 5 of these students. And 2 of those students are actually working with me now, Gabriele Chiviero and Alfredo Desiato. They are doing PhDs at the moment in Aston University. So hopefully you will see them in the future as big stars in Italy.
Thanks, Shazad.
Thanks.
So let me share the presentation and let's start with the talk. Clearly, I'm gonna speak just a few minutes just to introduce this seminar that, as you know, is about optometry education and scope of practice in Europe and in US. This is a very short disclosure. So I would like to start with a definition of optometrists and optometries. So the question is, what is an optometrist? It's not a simple. So it's not so simple to answer this question because optometrist is different depending on the country you consider. For example, in this editorial in Optometry Vision Science in 2004, the author brought a definition, but this definition is very narrow and maybe it was not up to date at that moment because, for example, optometry is defined as the professional trained and licensed to examine eye for visual defects, diagnosis problems or impairments, and prescribe corrective lenses. But this is too narrow. Clearly, the definition that we use today, nowadays, is slightly different. And it comes from the World Council of Optometry. And optometry is defined as an healthcare profession, so it's a little bit different, and it is autonomous, educated, and regulated. And optometries deliver primary health care in the vision care field. They can also, and that's the difference, the big difference, they can also not only include refraction and dispensing in their scope of practice, but also detection and diagnosis of disease, of eye disease, and also rehabilitation and rehabilitation. This is exactly the definition of the World Council of Optometry that you can find if you look at their website, and you can find the exact definition and the concept of optometry. But what the World Council of Optometry brought us several years ago was a scheme to classify the global competency scope of practice in optometry. So in other words, they put different level of a scope of practice that allow us today to see what is happening in different countries. So this is the 4 levels, the 4-step scope of model of scope of practice. And as you can see here, you see 4 levels. The first one is, for example, a professional that can offer optical technology services. And this is much more linked to optics, and so, for example, an optician is inside this category. The second one is visual function services, and as we will gonna see in a few moments, this is exactly what is happening now in Italy. So, basically, a professional, for example, in Italy, can provide visual functions services. So refraction and so on, and this is the first level in which you can call this professional optometrist. But there are 2 further steps in the scope of practice: ocular diagnosis services, either in terms of with diagnosis drugs or without diagnosis drug to examine, for example, the eye. And the last step is the ocular therapeutic services that can be provided by an optometrist. However, these kind of steps are not available in all the countries around the world, but in different countries, different level of scope of practice have been reached by optometrists. For example, let's have a look what happened in Europe. You can find this information, and this is the only piece of paper that I'm bringing to you today. So the Blue Book, written by European Council of Optometry and Optics in 2020, they summarize what's the, so basically with a snapshot what's happening in Europe and so in Italy and all the other countries around the optometrists. Clearly, the development of optometry in Europe is depended by different historical perspective that allow, for example, UK to stay ahead in this kind of scheme, and maybe Italy a little bit later in the development. Here we can see, for example, all the countries, the European countries, not only the European Union countries, but all. I mean, when I speak about Europe, I mean about a continent. And here you can find Italy. Italy is in the group 2. Let's have a look where it is. Okay, we are there. And it's strange that we are very close to Belgium. Maybe there is something interesting. Maybe tomorrow we will know who will move ahead in the scheme. Anyway, so here we are in the second in the second field. So in the step where we can provide it, as I mentioned before, just visual services, not diagnosis with or without drugs, not therapeutics, and so on. But it depends on the development of the profession. Here you can see, for example, the single activities divided in refraction, in, for example, eye examination, so investigative techniques that an Italian optometrist can provide it. Clearly, all this information have been provided to European Council of Optometry and Optics by the association. So we have to consider that it's official, but clearly the association offer a view of the condition in Italy that could be a little bit biased by maybe something that I'm going to present to you in the next slides. So, for example, what is there something that we can provide it and we cannot provide it? Clearly, we cannot provide it services linked to, for example, the use of drugs or the use of therapeutics, but we can certainly offer services around the refraction, objective refraction, subjective refraction, dispensing prescription spectacles. And this is not only because we are optometrists, because as we are going to see, optometry in Italy is not fully recognized, but just because the optician law allow the optician to perform some part of the optometry job, so the level 2 of the scope of practice according the World Council of Optometry. So, for example, very interestingly, in Italy, we don't need to refer, we are not required to refer to an ophthalmologist patients, but this is a nonsense in terms of primary care perspective. But this is what happened. So, for example, there are a lot of countries in Europe where the people is not it's not compulsory for professional like, for example, the Italian optician or optometrist to refer to an ophthalmologist. But this is actually a very important part of the job that Shehzad is presenting to you, and the condition of optometrists in UK. Very interestingly, let's have a look at what happened in terms of regulation. So as you can see here, if we see the category 2, so visual services, so refraction and so on, so the countries that follow in this category, we found clearly Italy. It's here, and it's stated that the profession is regulated by law. But as you can see in the specification below, it's not exactly this the meaning of that category. So, for example, what the Blue Book of European Council of Optometry Optics writes is the profession of optometry is not yet regulated, but there is a law. So the law refers to the law of optician that allow the optician education to perform some jobs, some activities that are in a certain way, something that that is in the optometrist profile. So in the scope of practice of optometrists. So if we see the last, that's the last slide. If we see at the education in Italy in optometry, what about the education that we have now? Clearly, from 20 years ago, and the university where I am working currently in Milan was the first one in Italy, we started with a bachelor in optometry. So 3 years, what we call in Italy triennale. And so we have a triennale that allow us to get a degree in optometry, but that's it. So for example, it's very difficult for our students to move ahead in a normal pathway that allow people to develop careers at university. For example, we don't have a postgraduate degree in optometry, as well as we don't have a PhDs in optometry. And that's a shame, because clearly we have a lot of brains that have to move abroad. As Shazad mentioned before, we have 2 students now that are running 2 PhD, 3 more exactly. We have 3 PhD students in UK now currently, so Italian students, and another one that already got it. But we have to move abroad. We cannot get a PhD in optometry in Italy in this moment. So as you can see, the snapshot of Italy condition is not so good, but we started. We started very recently, as I mentioned, basically 20 years ago at university, even though there were some courses before in optometry, like diploma or something like that, or courses in conjunction with foreign universities, as happened in the Verona story that Joanna mentioned before. So that's it. I would like to give to Shazad the end now. So Shazad, if you want to move ahead and present ourselves the condition of UK.
Fabrizio, thank you very much. That was a great introduction to what I'm going to be talking about as well. So thank you to the organizers for inviting me. This is a great opportunity to speak with colleagues in Italy. We're optometrists, and so we're biased. So if we were going to redesign eye care, do we need optometry? I suppose that's the question. And that's really what I'm going to try and answer. Does optometry have a place? Does it serve the global needs, especially in eye care? So next slide, please. Now, this is information that I got from the International Council of Ophthalmology webpage. So it's worth having a look at this. And what you will see here is that they've just listed some of the countries. And for example, you'll see countries like in Russia that the number of ophthalmologists per million of people, for example, and in Russia, for example, it's so over 100 ophthalmologists per million of population, but only 10% of those ophthalmologists are doing surgery. Now, if you look at the whole world, and these are just average figures from different countries, it's approximately 60% of ophthalmologists around the world are doing surgery. The rest are not surgical ophthalmologists. And in many ways, they're working as optometrists would do in the USA and some in the UK and other countries as well. So why is this important? Well, we estimate that there's almost 300 million people around the world who have visual impairment. To put that into perspective, that's nearly the population of USA. That's nearly the population of Europe. That's a big number of people around the world who have visual impairment. And the 2 biggest reasons are uncorrected refractive error and unoperated cataract. And over 80% of the visual impairments could be prevented or cured. Next slide. Next slide, please. Yeah. So on this slide, you can see here that if we look at, for example, cataract, it's approximately half of the eye pathologies, the ocular pathologies that we see around the world. And it's one of the biggest causes of global blindness. And I always find this quite upsetting, really, because a cataract surgery is one of the most common operations in the world, and it's probably the most common ophthalmic operation, surgical procedure in the world, and yet it's the largest cause of blindness in the world. And then the second pie chart, you can see that in that one we've also included uncorrected refractive error, and it's almost a quarter of our population have visual impairment because of uncorrected refractive error. And I always think, as optometrists, that's our problem. We need to deal with that. Okay, we don't operate on the cataracts. Of course, we do preoperative checks and postoperative checks, but we don't do the surgical procedure. But the refractive error, we can definitely help with that group of patients. So next slide. And these are some pictures of various projects that I've been involved in around the world, and how to implement services. Well, Fabrizio talked about this sort of 4 levels of personnel, and he also talked about in Italy, where you have a lot of people who have the brains, but they have to go overseas because they don't have the capacity to train further in Italy. So this could be an issue as well. So if you're going to implement eye care services, you need to first of all screen and see if there's a problem there, and that screening does not have to be done by a trained person, a qualified person. It has to be done by a trained person, so somebody who's trained in screening. And some of the projects I worked with, we trained school teachers, or we trained social workers or health workers to identify eye problems. But then you need a diagnostic service, a level of service where you can see what is the problem and what are you going to do with this. Maybe these patients need a dispensing service as well, and maybe they need a treatment or surgery as well. And for each of those levels, the training required will be different for each of those service deliveries. And even in the corner, you can see the picture of the little old lady there, and she has quite dense cataracts. And very often in developing countries, some of the elderly, especially female patients, are left blind with cataract because it's too expensive to operate on them for the family. And so this person often will have a reduced quality of life and a reduced self-worth because they don't think that they have a value to the family. And if this lady needs to go to the doctor, then somebody has to take a day off work or school to take her to the doctor. But if she had a cataract operated on, then she would be able to contribute to the family. She could help with the housework or the looking after children or something like this, or even work. So there are other things that she can do. And she has an increase in her self-worth as well. So next slide. Now, one of the problems when you train people just to be screeners is that you don't give them an autonomous career. And I've deliberately used that word autonomous because Fabrizio talked about the World Council of Optometry's definition of optometrists. And there's a couple of key words in there. And one is it's autonomous. Secondly, it's educated. And thirdly, it's regulated. So these are important aspects of optometry. People who are trained to be screeners only, well, some of them won't learn to do the job very well. And so they won't screen very effectively. Some of them will screen very well. And in fact, they'll say, look, this is great. I want to do more than this. I want to upskill. So we need to give them a career path so that they can do the next stage of the service delivery. And I think it's important to also to train to international standards, because then your professional body, your group of professionals who are trained at that level become part of a wider community. But of course, there are a lack of training institutions, there are a lack of optometry teachers. But the pandemic has taught us one thing: you can deliver didactic teaching, lecture type teaching via the internet, so via virtual learning environments. So this is a very powerful tool to deliver education to people where they lack good teachers or they lack the training institutions. And then, of course, there's also the battle of the public perception of these professions that we called allied health profession, or in some countries they call them mid-level healthcare professions. So how are these people perceived by the public or even by the governments? And certainly in some countries, I know in India recently, optometry has just become recognized by the government, but in Pakistan, for example, it isn't. So the the public will not necessarily perceive that this is a valuable profession. Okay, next slide. So this is back to the slide that Fabrizio was talking about, where he talks about the WCO categories of optometry services. So you can have your optical technical services and screening services, then your visual function, which is more to do with opticians, and then your optometry level, which is, I suppose, level 3, and then your physician level, which is the level 4. Now, I know Dr. Caruso will talk a little bit about level 4, because in the USA, that's what they will train to, and including some optometrists even taking on eye surgery as well. Okay, next slide. And again, if we box the countries, Italy is in box 2. So in Italy, you have opticians, but they have the ability to refract as well. Now, I know some of the opticians are working as optometrists and some are trained to that level, but that's not a recognized level within the national structure. In the UK, most of our optometrists are working to level 4. And there is an additional qualification that some optometrists are doing, and probably around 10% have done that now, which is to get independent prescribing rights and move to the box 5 in this slide. Next slide. Now, I'm just going to go back in history, and 1629 was the first sort of, if you like, professional body for opticians in England. And Charles I was the king at this time, and he gave what they call a royal charter. So he gave an approval, a stamp, if you like, a royal stamp, that he had said that the people who make spectacles, this is now is a profession. It's a professional job to make spectacles. So he he instituted this regulation of the quality of spectacles. Now, this company, Spectacle Makers Company, they eventually introduced exams as well for opticians and a syllabus. And then we also had the British Optical Association, which also had exams for the opticians. And these two bodies merged, and they became the College of Optometrists. And in fact, also from this became the Dispensing Opticians, a separate group. But the College of Optometrists took over the examination function for the spectacle makers and the British Optical Association. So next slide. And what that led to, and this is quite an important piece of law in UK law, was in 1958, it led to the Opticians Act. And in the Opticians Act, it clearly defined what an optician is and what an optometrist is, and what the role of an optician and what the role of an optometrist. And also, more importantly, it protected those terms. So the government is now saying, the law is saying, that you cannot call yourself an optician or an optometrist unless you are trained and passed those examinations and registered with the professional body called the General Optical Council. And the General Optical Council has exams. In fact, the General Optical Council doesn't run the exams. They give that function to other people. And in the UK, the other people are the College of Optometrists, and they run the exams. And the Opticians Act was renewed in 1989. And since then, there have been many amendments to include independent prescribing and things like that as well. So next slide. So in the UK, if you are wanting to study and become an optometrist, well, since 1965, you have to undertake a 3-year full-time university bachelor's degree. And in Scotland, it's actually 4 years because their school system is slightly different. So they do an extra year at university. They have more like the American high school system. And then the students enter what we call the scheme for registration. And this is a 1-year training program. And we used to call this the pre-registration year, the pre-reg year. After they pass the examinations of the College of Optometrists, they're allowed to register with the General Optical Council. So a student who finishes a degree in optometry from an optometry university is not an optometrist. They have a degree in optometry. When they do the scheme for registration, the pre-registration year, and pass the exams of the College of Optometrists, then they are registered with the General Optical Council and they become an optometrist the following year. And the General Optical Council, they will also visit all the universities, all the education providers, and make sure that the quality is good. So it's an external accreditation body. Okay, so next slide. And in this, what we call scheme for registration, it's 1 year, it's still full-time, and you're working under the direct supervision of a qualified optometrist. And in that 1 year, you also must spend, usually it's 1 day a week, observing an ophthalmologist, and usually in an eye hospital. And you also must do at least 500 eye examinations, 350 dispensers, 350 contact lens patients, etc., etc. So there are these quite strict requirements. There are also requirements for low vision patients, binocular vision patients, pediatric patients, pathology, all sorts of other things as well. And then you take the final exams, and then you can register with your final qualifications. So next slide. However, going back one slide. Sorry, Fabrizio. So the big news is, at the moment, the General Optical Council is changing this now. And in fact, the universities now will include the scheme for registration within their training. So you'll have a 3-year university program, and then the universities will be in charge of the scheme for registration. The universities won't keep the students in the university. They will send them to practices to have their training in external practices. But the universities and the companies will work more closely to make sure that the students get good experience before they can register. So next slide now. This is the final slide, just to give you information. If there is somebody who is an optometrist not qualified in the United Kingdom but wants to work in the United Kingdom, how do they do that? Well, they must apply to the General Optical Council, and they need to demonstrate that they have an equivalent experience and training that is equivalent to at least the scheme for registration year. So they've done at least 500 eye examinations, 350 contact lenses, etc. So they have to show that they have at least that minimum level of experience. Now, the GOC may look at the application and reject it. And I sit on the GOC board where we look at these applications from overseas, and we have rejected some from European countries where the training was not to the same level. Now, the applicants in many cases would argue that, well, I'm working as an optometrist, but their training was not to that level. So sometimes we have to reject those. And in many cases, the General Optical Council will ask the applicant to study various areas. And it may be that the applicant doesn't have enough experience of managing pathology or managing binocular vision patients. So they will ask them to have some additional training, and then they can register them. And nowadays, our General Optical Council also asks that all the successful applications, those people need to also undertake the scheme for registration, so this 1 year. Now, that's a little bit harsh for some people. For example, if we had somebody qualified in the USA, where they are trained, they are working, and they are registered at a higher level to the UK. At the moment, the way the UK law stands is that person from the USA would have to do the 1 year scheme for registration. Now, that seems a little bit unfair because those people are already trained to a higher level and work to a higher level. So the General Optical Council can consider these things on an individual basis and make exceptions in some cases as well. So that's a quick overview of the UK system and really the importance of eye care from optometry, from this primary eye care level around the world. So thank you very much. I'm going to hand over to Dr. Caruso.
So very nice, Shahzad. Thanks so much. It's a very clear picture, and thanks. I'll invite a little bit UK because you are much ahead of us, but that's good to know, and that's a good example to follow. So now I think we can look for questions in the public, but I can't see any. So maybe we will skip the question for the end of all our webinars. So maybe we can move to Joanne. And so now we will have the picture of US, or at least one part of US. So please, Joanne, go ahead.
Thank you so much. So I appreciate the opportunity to speak with this group this morning. And I am going to talk about optometry education and scope of practice in the United States. Next slide, please. And here's just my email and LinkedIn information. I have a private practice in Watertown, Massachusetts, and I am an adjunct associate professor at the New England College of Optometry in Boston. And there I help coordinate international programs in Europe and Israel, and also work as a clinical instructor with our fourth-year students at a community health center in Boston. Next slide, please. And so this morning, I'm going to talk about an American doctor of optometry and how that the educational system works in the United States. We'll look at some postgraduate residency programs, and then the scope of practice and billing procedures in the U.S. Next slide. So optometrists are America's primary eye health care providers, and we provide high-quality health and vision services. In the United States, there are over 30,000 doctors of optometry in the U.S. Next slide. And what does an optometrist do in the United States? Well, we examine, diagnose, treat, and manage diseases and disorders of the eyes. We do a complete exam. We prescribe glasses and contact lenses. We do binocular vision, vision training. Some optometrists will specialize in pediatrics, some in geriatric care or low vision. And then in many states, or in all states, optometrists can use diagnostic and therapeutic pharmaceutical agents. And in some states, optometrists can also perform certain surgical procedures, some laser procedures, and excision of chalazions. Next slide. And so we also play a major role the way optometry works in the U.S. So we play a major role in individuals' overall health. So we have, for example, primary care physicians that will refer patients to us that have diabetes or hypertension to check them on a yearly basis to make sure that they're not developing any side effects from the diabetes, such as diabetic retinopathy. We also play an important role in counseling our patients that do need, for example, cataract surgery, and looking at, both surgical and non-surgical options. We also do pre and post-op care, and we evaluate any visual needs of the patient based on their occupations or their lifestyle or any avocations they have. Next slide. In the United States, optometry is a regulated profession. And all the optometry schools are accredited by both the educational and optometric bodies. And optometrists need to have, all the optometrists in the US have to have a certain minimum standard. And the minimum standard is to pass the national board exam in optometry. And so those are written tests and also a practical test. And then some states also require additional tests and requirements for optometrists to practice in their state. Next slide. And so the educational system in the US is a little different than in Europe. Students usually start when they're about 5 years old. They'll go to kindergarten, and then they have an elementary school, and then a junior or middle school, and then a high school. And so it's usually about a 12-year program. And when they graduate from high school, they have, with their high school diploma, they can then choose to go on to either a 4-year university or a junior college or even a trade school. So for example, somebody that wanted to become an optician, after high school, they could go to a 2-year program. Someone that wanted to do optometry, they'd have to go to a 4-year college and then apply to optometry school. And this is just kind of how the system works in the United States. Next slide. And so sorry, can you go back? Thank you. And so we have the high school education, and then you get a bachelor's degree, and then you can apply to optometry school. You can major in anything. I mean, most optometrists do major in sciences of chemistry or biology or physics, but you really could even major in business. And as long as you have the prerequisites of biology, chemistry, physics classes, calculus, statistics, you can then apply to optometry school. And in order to apply, you also need to take an optometric OAT test, which is kind of like a basic test that tests your sciences, and it's kind of helps with the admissions process. Next slide, please. So optometry school in the U.S. is a 4-year professional education school after 4 years of college. And the optometry degree then it leads to the Doctor of Optometry degree. And in the United States, there are 23 colleges of optometry. Next slide, please. And as we can see here, some states have, more than one school. For example, California has 3. Massachusetts has 2. And we have the oldest school. So the top slide is the New England College of Optometry in Boston. And that school was established in 1884. And on the right side, the bottom school is Midwestern University, which is the Chicago College of Optometry, which was just opened in 2017. Next slide, please. And so what is optometry school like in the US? So again, it's a 4-year program. And the first 3 years are mainly didactic coursework to help you to prepare to practice in any state in the United States. So some states have a higher level of optometry than others, but each College of Optometry teaches the students to practice to the highest level that's available in the US. So after the 3 years of classwork, and actually even during those 3 years, the clinical experience starts for the students. So starts really in the first year where they might be sent to screenings or they might be working a half a day a week in clinic. Second year, they work at least a day a week in clinic seeing patients. And then in the third year, it's sometimes 1 or 2 days. The 4th year of optometry school is really 12 months in a clinical setting. And the students will go to a variety of places. They could go to a community health center, such as the one I work at, the VA hospitals, or specialty clinics. Some optometrists might want to focus on pediatrics or contact lens, low vision. And then they also will be going to private practices. And so that's really a full 12 months of the last year of school in clinic. Next slide, please. And so we can see here the 4 years in the optometry school in the U.S. The first year is really the kind of the bioscience, the basic classes, optics, visual science, and teaching them kind of the optometry methods. And again, the students do go out on screenings. The second year of optometry school is pharmacology, binocular vision, contact lens, and clinical medicine. The third year, it's more advanced ocular disease, pediatrics, strabismus, low vision, and advanced clinical techniques. The 4th year, as I said, is the full year is in clinic. And then some students will opt to do a residency program. But again, the key is that all the students have to pass the national board exam, and there's 3 parts to it. The first is the applied basic science. Part 2 is patient assessment and management and lots of cases. And then the third is a clinical skills. So there literally is a place in North Carolina where the students have to all go, all the students in the United States, and they take their practical. And once they pass all the national board exams, then they can then apply for licensure in the state. Next slide, please. And again, as I said, the clinical education system really works to make the student well-rounded and get exposed to many different parts of optometry. So there's primary care, there's advanced care, which is more hospital-based. There's contact lens, so specialty care, so they can look at advanced contact lens fits, scleral lens fits, low vision, dealing with low vision patients, or binocular vision. And then they usually have an elective rotation, which allows them to do a clinical rotation in an area that they might be more interested in. Next slide, please. And we train our students so that they are able to, achieve the highest level. So, case history, entrance tests with pupils, EOMs, color vision, retinoscopy and refractions, making decisions on how to, what to prescribe, visual fields, and then doing, a health exam, slit lamp exam, Goldman tonometry to rule out if a patient has glaucoma or not, or they're having issues with their pressure. Dilated fundus exam is really done on all patients. And then, the OCT fundus photos, things like that. And really, we work to build up their skills so that they're working at their highest level. Next slide, please. And so when you graduate from optometry school, you have to pass all parts of the national board. And then, as I said, some states may require additional tests beyond what the national board does. Next slide. And so, as I said, some students will opt to do a residency program. And about this year, if you will, there's about 25 to 28% of optometrists that graduate that will do a residency program. And the residency programs can be very varied. It can be in primary care, it can be in community health, vision therapy, cornea, contact lens, pediatrics. When I graduated from optometry school, I actually did, our college at the time, the New England College of Optometry, did a clinical teaching fellowship, and that's what I did. So I went to various community health centers and did more in terms of teaching. So there's really a variety of opportunities for specialization and to get, more skills in these areas when the graduates decide to do residency programs. Next slide, please. And so in the U.S., the scope of practice is, pretty varied. As we can see here in the dark purple, there's actually 4 states that optometrists can do all the procedures. They're Alaska, Oklahoma, Louisiana, and Kentucky. And so they can, if an optometrist that is working in those states are granted the ability to do all procedures, to also do laser, and so that's at the highest level. The other states are all at various levels. Next slide, please. But you can see here, now actually, Massachusetts was actually just the last state to allow optometrists to treat glaucoma. So now we're all at able to treat glaucoma. But again, the states will vary in terms of the level of prescription ability that the optometrist has. Next slide. And then in terms of surgical authority, in some states, optometrists can remove, as I said, chalazions, lumps and bumps. And in some states, they can also do laser treatment. So they can do laser treatment, for example, a YAG capsulotomy, post-cataract surgery, or they can do laser treatment for glaucoma. And there's only a few states, Alaska, Arkansas, Kentucky, Louisiana, Oklahoma, and Wyoming, that allow optometrists to do laser treatment. But it does take, time. So for example, if we look at the fact that Massachusetts is now, just the beginning of this year in 2021, we were granted the ability to treat glaucoma. If we think about it, the first state that was granted that was West Virginia in 1978. And so it's taken many years for the last state, which was Massachusetts, to be able to be given that opportunity. And so sometimes it does take time for things to change because our regulations are really state by state. Next slide, please. And so optometrists in the US are able to bill for eye exams, and we can bill them either through a patient's health insurance, or if they have a vision insurance, or private pay. So, and I think that's a bit different than in Italy. And then eyeglass and contact lens are also at an additional cost. So sometimes it's private pay, or most of the time, I should say, it's private pay, although sometimes health or vision insurances will pay towards their cost. Next slide. And I think the other thing that may be a bit different is that in the US, we practice more of a defensive medicine or optometry. And so we practice in such a way that we try to reduce the risk of any malpractice litigation. And sometimes that's by doing excessive diagnostic testing. But I would say that we, at least the way I practice, is to do what's best for the patient and make sure that we, don't miss anything. And so, I think it's more of a defensive medicine. And then we are required to have malpractice insurance. And the insurance that the optometrists have to have usually is at least that it covers $2 million, $4 million per incident. And hopefully, we never have to rely on that insurance. Next slide, please. And so I just wanted to kind of talk briefly about if an optometrist that was an international, had wanted to do an international program. It's a little bit different educational system. And so it's an advanced standing international program, which allows optometrists that have been trained in a different country to come to the US. And so the requirements are you have had to graduate from an optometry program, usually a bachelor's degree program or higher, and have 2 years of optometric experience working before you can apply. And the curriculum is set to help improve a student's previous education, and it includes basic and advanced sciences and clinical care. It's usually about 1 year full-time of didactic classwork and 12 months of clinical work. Next slide. So in 1992, our college was actually able to do a program in Verona, Italy. The president of our college at the time, Dr. Larry Clausen, had been contacted by the school in Verona. And what we did was, instead of the students coming to Boston for the didactic work, we actually sent our faculty to Verona to teach the course in Verona. And our program was approved by the American Council on Optometric Education. And so we ended up having 8 students who graduated with their degree in 1997, and they are practicing in Italy. And I think the whole point of our work at that time was to hopefully improve the education of optometry in Italy. And I will say that we were able to, Dr. Rosella Fonti worked with, the Federottica and the other optometric organizations, and they started by putting the first optometry program in the school, the University of Milan in Bicocca, and then it's led to other optometry schools. Next slide, please. And here we just have a picture of the students, and starting on the right, you have Giuliano Elodi, who's in Parma, Nicola Verdolini, Marco Franza, Rosella Fonti, Nelson Ferrarini. Then we had the Dean, Dave Heath, and Dr. Clausen, myself, Enrico Regatieri, who's in Verona, and Giovanni Martinelli. Missing from this is Elena Peliscar, who graduated in the program also, and she's in Trieste. And so I think that, very happy that I was able to speak with you guys today, to this program today, because I think that, our goal way back then was to hopefully help improve optometry or increase the level of optometry in Italy. And I think that, sometimes it does take, such as the glaucoma bill in Massachusetts, it does take 30 or 40 years to get things to a different level, but I think it's, possible. Next slide, please. And these are just my references for my talk. And then I would be remiss if I didn't put this last slide in, because if you could do next slide, please. And as you see here, I know at 9 p.m. tonight, Italy is playing, and this is my husband and my 2 sons, my husband Antonio, Tonino, and Christian, who are looking forward to watching the Italia play today. Thank you so much.
Okay. Thank you also for this, let's say, sport, let's say, slide, football slide. So very interesting, Joanne. Thank you.
Thank you.
And now I'm going to look at the chat if there is comments. We have comments from Anto Rossetti that you probably know. Maybe you can put on the comments. It's thanks for the 3 presentation. Food for thought. I agree with Anto. We have a lot of argument to thought. I think the main problem in Italy is regulation. We don't even have any regulation, and this is the worst condition ever. I have several experts to start discussion now. I will introduce one by one. Now, the first who want to comment or have question is Nunzio. So please put Nunzio on. So Nunzio comes from the SOPTI, which is the Optometric Society of Italy. I would translate like this. So Nunzio, please.
Hello, everyone, and it's a pleasure to be here with you, spending this day talking about optometry. I'm here to represent SOPTI, and for those of the listeners who doesn't know SOPTI is a non-profit association that was founded to promote optometric culture. And we organize seminars or conference and meetings in order to kind of improve the knowledge of the Italian optometrists, and we also provide some ethical regulation or recommendation to follow to carry out optometric practice. I would like also to thank you all the speakers because they were really very interesting talks. I want to comment that optometry is a very important social profession. It is in Italy as well. We provide good service in terms of refraction, specialized contact lenses. But we believe that we miss a regulation. We miss a regulation because we miss the minimum standard. I try to expand this concept. In Italy, if you go to an optometrist, you might have a different kind of service depending if you go in Milan or in Rome or in a local place. And this is something that is not good for the patient. So a patient that attend an optometry practice should receive the same service everywhere. And there should be a minimal service. The problem that not everyone, as Shehzad said, want to upskill. That's why SOPTI believes that there should be 2 different roles. An optician who provides minimal refraction, and also an optometrist that specialize in different areas and provide better service. And with this lack of regulation, I think there is also the problem that universities cannot provide further education, master degrees, or PhD, because not all optometrists believe that they can upskill in Italy. So maybe I'm a bit drastic, but I think it's a good starting point for the discussion. And I would like to hear from the others, for the speakers, if they believe the same as I told. And I leave the word to other speakers.
Okay, thank you. I would add to your comments also one comment from the public, which is again Anto, which is asking a more, let's say, precise question to our speaker, but in the same line you did, Nunzio. So you can read, I can read for you. Taking into consideration Italian setting is different, either for education and health system. Which kind of optometry you find we should pursue? So this could be a question which is similar to yours, Nunzio. So please, Shehzad and Johan.
So I guess I would say I think that you need to pursue a level that is maybe a more of a European standard. Maybe look at a UK level or a Germany level, Swiss level, and try to maybe achieve that, I would say.
That's a good point. We are in a community, so let's listen UK that it's just out of the community in a few months.
Yeah, I would agree with Dr. Caruso. I think that looking at a standard like Germany or Switzerland or Sweden or UK would be the aspiration. But going back to Nuncio's point, I think getting some sort of regulation is quite important as well, because then you protect the profession, and that seems to be lacking at the moment. And I think before you can say we want to be at this level, I think you need to protect what you have, and then you can move it forward.
Fabrizio, what's your view in this?
Well, I think the optician part of the story is already protected, is regulated by law, but we have to move a step ahead and further step in another direction. I don't know what's the best direction, but clearly we have a pathway well defined. That is the pathway defined by WCO, and clearly we should try to reach at least a full recognition in terms of prescription, for example, or just to consolidate it, the second step that could be fine, and then try to move ahead to the screening and so on. I think it's a long process, maybe too long for one person, single person. If I today I heard by Joan that optometry was established in 1884. Really, Joan? So 115 years ago. So we have a long story in front of us. I'm sorry, I'm too old for maybe to see that, but it's a shame for my life. But maybe it's not shame for Nunzio. That has been my students, or for the students that now Nunzio is following. It's something that we have to try to pursue for a better development of the profession. Unfortunately, it's a very long process. I don't know if I will see it. But I have to. Yeah,
I was going to say it is a long process, Fabrizio. If you look at even the glaucoma bill in Massachusetts, so if you think about it, in 1978, optometrists could treat glaucoma, and it has taken the optometrists in Massachusetts over 40 years to get to that point. And so a lot of it, I think, is similar in that you have to legislate and you have to try to go through the government system. I think we were very happy. Our school was very happy when optometry started to appear in the universities in Bicocca and Firenze, because we felt like it was getting into the university system. But I totally understand that trying to get it to regulate is a long process, but you have to start someplace.
I fully agree. A bad regulation is much better than no regulation. So we need some regulation to start to fight to have more, but if we have any, it's really tough. So now there is Antonio who want to comment. Antonio is the teacher of optometry in our university, and please give us your view.
Okay, thank you to all. It's a pleasure for me to hear you here. And I'm thinking that it's very curious that the history of regulation of optician profession in Italy and in UK started at the same time, because as far as I understand, the first law in UK was in 1921, correct, Suzad? 1929?
1629 was the first royal charter, yes.
16, okay.
16? No, I mean the regulation of profession.
Oh, the first Opticians Act was in 1958.
Okay. In Italy, we start in 1928. And after 100 years, we have not any regulation, unfortunately, about the profession of optometry. It's very strange in my view, because we have an high-level education starting more than 20 years ago in Italy. Now we have several degrees in several cities here in Italy. But our students that become a doctor of optics and optometry have not any regulation. So to work, they have to look at the regulation of optician. It's so old law here in Italy. So we miss something. And for your part, have you any suggestion to give us to convince our government agency of the importance of a regulation, a nice regulation, because I don't think that a bad regulation is better than nothing. Sometimes it's better nothing than bad regulation, in my opinion.
I think
Any advice, any suggestions?
I don't think you need to be disheartened, because some of the things that we're talking about take many years, and Dr. Caruso was talking about 40 years for the glaucoma regulation in Massachusetts, or 1958 for Opticians Act. But you can learn from your neighbors and your colleagues, and you can use their learning experience to accelerate your programs. That would be the first comment. And the second thing, I think you also need to convince the other stakeholders, and that might be the doctors, it might be ophthalmologists, it might be the government and the health ministers, that you have an important role. And in my mind, if you look at countries where optometry is weak, like Japan or Brazil or Russia, then some of the primary services, if you look at for example, their contact lens prescribing, they are fitting spherical lenses to toric patients, to astigmats. So, there are examples where we can see that if the optometry is not in that country, then the primary eye care level is taught at a very basic level and delivered at a very basic level. And remember that ophthalmologists are very expensive people to train. So why don't we utilize their skills in surgery? We have an aging population, use them for cataracts. And ophthalmologists should realize that when you work with optometrists, they will actually make more money because they'll be doing surgery and all the optometrists will be feeding the patients to them.
Yeah, I agree with this. And yes, this is the problem. This is why I hope we may have some kind of impact, even if maybe it's too optimistic to imagine that we have an impact. But anyway, we have to start from what we can do. So maybe we can put, I don't know.
I have a question
Yes,
for
please.
Joan. What do you think about our level of starting the educational process in Department of Physics? So optometry now is controlled by people like very good people, fortunately, but like Massimo Gurioli in Florence, and Professor Borghesi established the first degree in Milan, and they are very clever, I think, in terms of see the optometric perspective, but they are not exactly what the optometry is in all around the world. So it's something that very linked to health services. So clearly now we are in this frame, in this box, very close to physics, but we are a little bit far from the health services. So do you think we did the right things and we should try to transform this box in something different? Or what was the experience? For example, John, maybe you did the same thing just to be far from the medicine at the beginning of the history of the story of the optometry. I don't know if in UK happened the same things, Shazad. But do you have any suggestions? So it's better to stay with our physicist friends, or we should stay closer to our enemy. So so basically
competitors. Let's say competitors.
The ophthalmologists. I don't know. What do you suggest?
I mean, I think, for example, some of our schools started as schools of optics and then became schools of optometry. So technically, the New England College of Optometry started as a Klein School of Optics, if you will, and then transformed over the years. I think that at the time, if I recall correctly, I think that it was important for Italian optometry to get into the university system, and the closest link was physics. But I don't know if now, for example, would that university say, okay, you know what, we'd like to now transform this into a department of optometry and remove it from physics, but still keep it within the university. I don't know if that's a possibility. I know some optometry schools in the US are part of a big university system, but then there's a school of optometry. But again, I don't, I'm sure the politics are very convoluted.
Well, I think you're right. UK is very similar. Most of our optometry schools grew out of departments of physics. But if you look around the world, there are optometry schools that have grown out of medical schools and life health sciences schools. And in some of those places, the medical school will try and control the optometry for much longer. And I think sometimes the physicists, they don't necessarily want to control. So there's a different sort of relationship there because it's less competitive. But I go back to what Fabrizio talked about in his definition. There's three words, of course, that the WCO say: regulated, educated, and autonomous. In Italy at the moment, you don't have regulation and you're not autonomous. You just have the education at the moment. So you need the other two.
Partially said a partial education, because we have just a triennale, so just three years degree in optometry, but it's something.
No, I think you have good education. I don't doubt that, but it's the other things that are missing. And once you have those things, even the education can grow further.
Yeah.
Okay, let's listen Marco, which is the head of the degree in Rome. And so please.
Okay, hi everyone, and thanks a lot for the formidable talks we've just listened. Now, just curiosity that popped out of my mind. I think that one of the issues here in Italy is the fact that in people's mind, the two figures of the optometrist and of the dispensing optician are so interwoven. There are reasons for that. That's how the profession has started. And there are many dispensing opticians that are excellent optometrists. We have one outstanding example among us. And my question for you is, how harmful would that be for the profession? Should we try and make an effort to emphasize the differences? Should we actually stick being together? What should we do, in your opinion?
Okay, I think maybe Fabrizio can start, who knows the Italian situation better, and then looks the other.
That's a very, so thank you very much, Marco, for your question. That's it's a very difficult question, because, for example, in the history of optometry, optometry history in Italy, we have had different position on this question. Sopti was born was established to try to divide the two professions, because if you keep together the two professionals, you risk to stay on the first stage of the development. Clearly, you can reach the second one, but you have a lot of dispensing opticians that don't care about optometry. So that's the risk, and that's the reason why, for example, Sopti started trying to divide the two professionals. Instead, other association that I know that there is Anto can give a contribute in this, but lots of association in Italy try to put together. We are one of the I think few countries that we have awards for defining the same profession. So ottico optometrista, that is a nonsense in the UK tradition, and it's something that leads to take the optometrist and put inside with the dispensing optician. It's not bad, but it's not good, certainly. So in other words, I don't know what is the best things to do, but clearly, historically, we have tried to pursue two different pathway, but up to now, till now, we're not successful in arrange a better condition for optometry in terms of recognition, education, and so on.
Let's listen also the other two Italian experts. So Antonio. No, the mic.
You are mute, Antonio.
Okay, now.
Sorry for that. I'm I'm talking without any any results. Sorry for that. Starting from the question of Fabrizio, if physics is the right place where to study optometry instead of medicine, for example, I think that physics is more than the right place, because optometry need the knowledge of optics, because an optometrist, an eye care profession that have not a strong background in optics is without an important piece of knowledge. And optics is a part of physics, no question about that.
No question.
And as far as I know, I have my son is a student of medicine, and they study only for one part of exam in physics, so they study other. That is very important. That they have a lot of things to study, but they have not the mentality of measurement. Optometry means measurement of sight in Greeks, and the measurement is a skill of physics, not of medicine. So obviously, if one person that can measure but without any clinical knowledge is not an optometrist, of course. So I think that we need a strong cooperation between the different departments. But as always, the money sometimes win over the need of people. So I think that the risk, if we move from physics faculty department in medicine, we miss an important part of the three walls. We risk to miss the autonomy of the profession. And
I agree, Antonio, and I want also to say that any interdisciplinary matters like material science or things like this, which are between physics and chemistry. So they need to start from one side and then grow up in let's say, in an autonomous way.
Absolutely.
Okay, so
if I remember, in UK, optometry at the university started physics at the City University, correct?
Yes, correct. Yes.
So we have the best model that we have in Italy, in Europe. Start from the Department of Physics in the City University. Then they move, but the starting point, my opinion, of course, is my opinion, must be the mentality of physics. It's very important.
Let's listen Shehazad and Joan, and then we have Alessandro, which is our physics representative in the national community, and listen also. So first Shehazad and Joan, very briefly on this point, and then let's listen Alessandro.
No, I have nothing to add. I agree with Antonio. I think he's raised a good point there. So thank you.
And I agree too that it's good in physics, but I guess I don't understand. And again, I don't understand the university politics or the structure. Why you couldn't then have a department of optometry? No.
That's a good question for Alessandro, please.
Oh, okay. I think, can you hear me?
Yes. Please go on.
So first of all, I would like to start from the observation by Antonio about measurement. I agree with him, obviously. Measurement is something having born within physics. And so it must be, again, physicists to do measurements. But you should remember that we have to fight a hard war, not only against doctors, medicine doctors in Italy, but also against engineers, which when you come to the problem of, for example, certified instruments and so on, they always say that that's their matter, not a matter for physicists, and that's a big point, I think. And I have a question for Johan about how the optometrists work in the USA, because as I understand, they work like an healthcare professional. So I expect that they work in structures devoted to such profession. While I think that in Italy, up to now, and as a consequence of lacking of regulations and of autonomy, usually optometrists work in shops, mainly. So that's the big point. And coming to the point related with regulation, you know that now we should finally have the physicist profession regulated in Italy, even if we still don't have the competences still have to be written. And in there, if I will remember, there is also a part devoted to optometrists. So that could be a good starting point. And the other point which could be good for optometrists is that the regulation is made under the umbrella of the Ministry of Health. So that could be helpful for you, not for all the physicists, but surely for optometrists. But I think at the same time that we can't, that's my opinion, we can't take optometry within physics departments only, because otherwise we can't get the possibility to work in autonomy as you are just asking. We should share something with medicine. Otherwise, I don't think that we can win something useful.
Okay.
Massimo, may I take just 1 second, because I know
No, please. Sorry.
Shehzad has to go.
Shehzad brought that he has to move. So Shehzad,
okay. Thank you very much.
Thanks a lot for your time, and thanks a lot for your talk. So we will keep in touch if anything we need from you. Okay. Thanks so much.
Thank you.
Thanks, Shehzad. Thanks so much. So now there is Marco, and there was this question to Joan from Alessandro about where the optometrists work in US, and then Marco has some comment.
So the optometrist, for example, I have my own office. I run my own office. I do even the eyeglass part of it too. I do the exams, and I have my own office in Watertown. I also work at a community health center. So I work under the direction of the community health center and the eye clinic. And so we work under their rules, if you will. But optometrists can work with ophthalmologists. They can work by themselves. They can work in group practices. They can work in hospitals. So there's very varied possibilities of what optometrists can do in the US. And they also work, for example, in eyeglass chains, if you will, like Lens Crafters or Provision, but they have to be independent. They can't be their practice is independent of the chain. But so that's kind of the different areas that we can work in.
Okay. So Marco, then probably Antonio can comment also the fact that optometrists only work in shops, but then later maybe. So Marco.
Okay, I have heard this very interesting comment on the fact that physics might be the right place to host optometry and to work as a, let's say, as a greenhouse to have optometry do the profession grow. And I accept that has been the way that it has occurred in the UK. But we should not forget, and that's some kind of comment I'm making to my own community, that physicists in the UK tend to be a bit more multidisciplinary and way less conservative than Italian physicists are. that's an attitude we have. We tend to focus on our own work, and we are not that interested in life science. There's a few of us who do that, but they are bad looks by part of the community. So I think that first of all, if we want to make this profession grow, we should work on our side to make our community more interested, more curious, and more dialoguing, more keener to discuss with professionals outside our fence, let's say. So yes, physics can be a fantastic discipline to ground our optometry on, but it requires on our side a different kind of approach than the one we have had until now, perhaps. And I think that one point that we are missing in this conversation is that probably the problem we have in Italy is that there is no immediate recognition of the profession by the layperson. Sorry. I mean, it's not easy to explain what an optometrist does, because somehow some of of their competence are taken by the ophthalmologist, some of them by the optician. We have to think hard of the kind of figure we want to shape, that we want to, the proposal we are offering to our students, and do make an effort to bring that out there to the public and make this fantastic discipline known to the big public. This is probably one bit that has been missing over the last 10 years. Of course, we were trying to figure out what was going on. But these days, that the field is much more mature than it was 10 years ago. We should also make an effort in communicating what the profession is, and where the advantages of having someone dedicated to this primary eye care could be for the large public, for the society at large.
Yes, I do think, Marco, this is our job. So we have to do this. We are on the front line, so we have to do this. But I think we are trying to do it.
But
yeah, of course. We need someone behind us that push us. But this is more or less what we have to. In this sense, so there is also a comment of Anto. There is many. Let's put the last one. And maybe this is also for Alessandro, and then Nuzio has a comment. So can you put the comment of Anto? It seems important to remember that currently physicist is actually by law regulated as health professional.
That's a bit stretched. I don't think that's correct.
Recently not clear what this will precisely mean. So maybe Alessandro, you can explain us what the let's say profession of physicists put as optometrician and optics inside.
As I understand now, the physicists professional are under the umbrella of the Ministry of Health, but that doesn't mean exactly that all the physicists are to work within the health system. There should be, that's a discussion, because they are discussing it, I think, while writing the specification of the profession, because there should be many different topics within the physicist profession, and some of them within the health system, some of them not. So I understand. But unfortunately, it's almost 2 years that we have no real news from who is working on setting this set of competencies. The last release I saw was about 2 years ago, and after that, nothing. I'm just trying to understand who is now in charge in the ministry, because I was saying that one functional was working on it, but he was retiring in last years. So I still have to understand who is working on this. If I will succeed, I will let you know.
Yes, please. Yes, please. So now there is a question from Nunzio and then one from Fabrizio, and then we will summarize everything. Now, Mike.
Sorry. My question is about the chances the students have to make practice in the University of Physics. I'm looking at UK university or even US university. After the 3 years, they have the chance to practice or residence or pre-registration scheme, as Cesar was telling us. In Italy, students can do an internship of certain amount of hours. When I had the chance to study in Scotland, in Glasgow University, and at the third year, I had the chance to see real patients or paid patients that were coming they were paid to be patients for students. So students have the chance to train their skills to real patients, not only amongst them. So I know it's very difficult to arrange for University of Physics, but is there any chance that we can maybe extend the program from 3 years to 4 years to give more chance to practice on real patients? That's my question.
Yeah. I think Fabrizio comments is in this line, but first maybe Antonio, you can explain what we do in Florence. So we have the possibility to work with not with the ophthalmologists, but also optometric people like you, and they can do practice, even if for a short period. Antonio.
Yes, unfortunately, in Italy, every school of optometry at the university have not a clinic inside, and this may be an issue for the practice of the student. But all the students must to practice outside the university, at least for 200 hours of so they are not really under the control of university, but they have the opportunity to do that. For example, our student in Florence can choose also to practice at a small group at the hospital of Careggi in Florence. Some of our students practice there. Other practice in the industry, for example, CSO, that is an important industry in the Florence area, or in another part. So we miss something, but again, we are at the beginning, and our beginning is very, very long because we started 20 years ago. We can do better, sure, we can do better, but I hope that in the next future we can start with a real cooperation between several departments. No physics alone or medicine alone, but work together. And in Florence, we are a little bit lucky because we have a very good relation with ophthalmologists of the University of Medicine in Florence.
That's true. We can improve it, but we have it. So Nunzio, Nunzio, just to tell you, then we cannot have 4 years university degree. It's 3 or 5. And about 5, Fabrizio has something to add, but maybe Jean wants to say something.
So I was just going to suggest, one thing, and you may have already considered it, is setting up a clinic at your university and opening it up to all the people that work in the university, or even the students, and that way the optometry students can have patients and have the ability to see patients, and that might change their ability to see more patients and learn a lot more. It's something to consider. For example, our clinic our own clinic is in the middle of Boston University, and so they attract a lot of students from Boston University, and they can come there and do their eye exams. But that may be something to consider.
Yes, but you know, as Marco is writing in the chat, it's very difficult in Italy to have a collaboration with medicine. But of course, this is the path, but it's not so easy. Fabrizio want to tell us that in Milano they are thinking about a second degree. So please, Fabrizio.
Yeah, no, just to add something about clinics. So clinics make difference, and for sure, my experience in UK, I've been there for 2 years in Aston University, and clinics are what can make difference in terms of health development, in terms of health allied professional development. But anyway, so I would like just to ask a suggestion, because we have some, we didn't have time to speak about other countries, but we have an example of country in Europe. I would like to mention this, the Poland. Poland is not a optometry recognized, fully recognized. They cannot perform, they cannot have a practitioner that have a very high standard level in optometry in terms of scope of practice, but they have the triennale, so the Bachelor of Sciences degree, the postgraduate degree, and the PhDs. So they have all the pathway in terms of educational process. So that is very strange and unusual condition. So, and this is my question. So we would like to move ahead a step in terms of a further educational step, I mean, magistrale, so other 2 years. Do you suggest that we can, so for example, in terms, if you have a wishing list for a magistrale, what would you like to put in the wishing list in terms of, for example, modules, educational background, and also I will ask to Joanna. So what would you suggest to put ahead, like the first 2 or 3 things in the wishing list for the next our next step in educational in optometry? So I mean magistrale, so the postgraduate 2 years degree, because that's the goal, that's the close goal that we would like to reach soon.
To get a master's degree.
No, yeah. I mean what we call it. Think about 2 years more of education in optometry. Right. So, yeah.
So, I mean, I think a master's degree is helpful. I know that, we've had actually, we teach in Germany, and a lot of the students from Italy, some of the students from Italy have come to do that program. So I think that if you could do something in Italy, I think that you would probably attract more students, and by doing a master's program. And I think it is helpful to increase the level of the optometry. Because the one we help with in Germany, our college focuses on the ocular disease part, and so teaching them skills like dilation and tonometry and things like that. So I think that might be helpful.
Okay. So we are 1 hour 40. This is more or less the time we use in our webinars, not more. I don't want to have to abuse of your patience and things. I think this +2 is the goal. I don't know how near it is. We also need students, because this is the other problem. We need teachers and students. That's the problem. If we have few students, we have few teachers, we have few money, it's very difficult. But maybe Marco and Fabrizio, maybe we can think to some inter-Ateneo kind of stuff, where teachers from Florence, or we can do some kind of, I don't know, remote university. I don't know. We can think about. We must be, let's say, in some sense, we must be with some new ideas, because otherwise it will be almost impossible. That's my feeling.
Massimo, I think that in order to have more students looking for higher education in this field, I think that the important thing is that to be able to make them, to give them the possibility to work autonomously, as was said.
Yeah. Regulation is important in this.
Regulation is important. The possibility to work autonomously, which now is not so easy in Italy.
That's true. That's true. So if any other has a small comments, please. Otherwise, we close here. Any one of you want to add something? No. So if not, thanks everybody. It was a
Thank you.
pleasure. And
Thank you.
John,
Bye, everyone.
have a nice day.
Bye-bye.
Bye.
Thank you.
If we
Thanks,
stay
Joan.
here after
Thanks,
the
Joan.
closing, we can say hi in the private part.
Right.
So hi to everybody, Juan. And
Bye-bye.
see you next year.
Bye.
Bye.
See you.